Hello, guys. Today we'll talk about the real risk factors for heart disease and what you can do about them. If you've been told that you have high blood pressure, high cholesterol, rising triglycerides level, pre-diabetes, or a strong family history of heart disease, then I want to begin with something reassuring here. Most heart disease risks develop slowly, and many of the risk factors are modifiable. Heart disease doesn't usually begin with a dramatic event, okay? It develops gradually through patterns that place strain on your metabolism and circulation over time. Let's talk about the most common risk factors you hear about in primary care. First, high blood pressure. Blood pressure often rises when several conditions are present, okay? And that includes when your sodium intake is high from processed foods, when insulin resistance is present, also when stress is chronic and your sleep is poor. When blood sugar is unstable and stress hormones stay elevated, blood vessels remain under tension, okay? And that's what causes high blood pressure. Secondly, high cholesterol. Cholesterol numbers can rise for many reasons, okay? And that includes inflammation, diet quality, fiber intake, genetics even, and also metabolic stress, okay? What matters most is not panic, but understanding what's driving your specific pattern. Third risk factor is elevated triglycerides. Triglycerides are often a reflection of blood sugar instability and excess refined carbs intake. They can also be linked to fatty liver and insulin resistance. And that takes us to the fourth risk factor, which is insulin resistance. This is one of the most overlooked cardiovascular risk factors, actually. Insulin resistance can exist for years before blood sugar becomes abnormal. It contributes to abnormal weight gain, rising triglycerides, elevated blood pressure, and worsening lipid patterns. And then another risk factor is abdominal or visceral weight gain. Central weight gain is metabolically active. It produces inflammatory signals that increase your cardiovascular risk over time. And then, of course, there are lifestyle factors like sedentary patterns, chronic stress, poor sleep, ultra-processed food intake, smoking, excess alcohol, etc. Now, here is the encouraging part. Most of these risk factors respond to gradual, consistent lifestyle shifts, okay? When meals are balanced with protein, fiber, and healthy fats, your blood sugar stabilizes. When movement becomes regular, insulin sensitivity improves. When sleep is protected, your blood pressure and cortisol regulation improve. And when stress is addressed, vascular strain decreases. And also, when your nutrition quality improves, your lipid pattern often follows. This is not about extreme dieting, okay? And it's not about abandoning your medication if you need it. In fact, many people can work closely with your primary care doctor while simultaneously improving your metabolic foundation. Inside my comprehensive holistic recovery program, I guide you through a progressive reset process where you learn how to stabilize your blood sugar, improve your insulin sensitivity, reduce inflammatory load, and definitely to support a healthy weight and regulate your stress physiology, improve your sleep patterns, and build your meals intelligently without rigid rules, okay? You'll be given a clear roadmap and practical tools, okay? But you apply them in a way that fits your own life. Because the goal here is not restriction, okay? The goal is to restore your own capacity. You'll be encouraged to get labs from your own personal doctors, okay? Or with us, it doesn't matter. If your labs are trending upwards, even slightly, that's not a failure. It's just feedback for you to note, okay? And early signals are far easier to influence than advanced disease. If you'd like to better understand your personal risk patterns and what's driving them, I invite you to book a free vitality session with me, okay? Or if you're ready to start taking a proactive guided approach to improving your metabolic foundation, then you're welcome inside my comprehensive holistic recovery program. Today, I just want you to remember that heart disease risk is not destiny, all right? It's often the result of patterns. And guess what? Patterns can change. So thanks for watching. And if you like what you learned today, then go ahead and subscribe to my channel, all right? And check out the links in my description section to learn more about the programs. See you in the next video.